Hi, my name is Corey, and today I'll be demonstrating on how to do a proper urine analysis test. First, you want to make sure that you have a clean workspace, that you have proper cleaning material to clean up afterwards. You need one pair of gloves, hand sanitizer, and a proper container for the urine sample. It's important to have the patient or the athlete's name, date of birth, and urine sample number. Before you do anything, it's important to check your urine test strips for the expiration date. In this case, it's March 31st, 2019, which is good, and this is the given lot number. I would like to show you what a test strip looks like. It's a thin plastic tool that has 6 individual squares that have chemicals on them. So when you place it in the urine, it would change colors to detect anything such as blood, glucose, any type of direct trauma to the kidneys or the intestines that will filter out. Before you start anything, it's important to tell the athlete to do this thing that we call a clean catch, which they would wipe off the penis head or the vagina, so when they urinate into the cup, that any type of bacteria down there will not get into the sample. Also, it's important just to fill it up 1 to 2 ounces. Anything more than that is unnecessary. You first want to make sure that you clean your hands properly and place the gloves on. Now, it's important once you get the urine sample back is to check for the color, if it gives any odor, and also if it's warm or cold. If it's cold, it means that they have another urine sample with them and they dump this in here. In this case, this is slightly yellow, my bad, and this is clear, which this is a good sample. It doesn't have any odor to it, and when they bring the sample back, you do want to just make sure that that is the patient's name and is their date of birth. You open up the container, place the test strip directly in, completely submerge, hold it there for maybe about 10 seconds, pull it straight out, let any excess urine drip off. When you place it down on the paper towel, you want to make sure it's horizontal. You do not want to cross-contaminate the test sample. The longer that you let it sit here, it can change the chemicals. It's important to know too that doing this urine analysis test, this one is less accurate but quick, fast, and cheaper than going to a laboratory to get this done. Okay. And once you have the urine sample here, you want to match it up. So in this case, the blood is yellow, which would be negative. The urobilinogen is white, which is normal. The protein is slightly yellow, but and a slightly green, so in this case it would be negative. The nitrate is white, which is negative. The glucose, which is a slight yellow tint, which is negative. Normal would be green, and the leukocytes is white, which is negative. So in this case, this urine sample is good. You want to make sure that you close up the test sample. Take the urine sample and properly dispose of it. You would flush the urine sample down the toilet. It's proper to throw the container in the biohazard bin. Same with the urine sample. Properly dispose of your gloves. And when you're done, you want to make sure that you wash your hands. And that's how you do a proper urine analysis test. Thank you.